So let me see a show of hands. How many in the room are parents? Great. Keep your hands raised if, as a parent, you would do anything it takes to help your child. So now I want you to picture that your beautiful son, Sam, who's 2, has started to feel ill. You notice that he's not as playful as he used to be, and he's getting bruises in places on his body that 2-year-olds shouldn't have bruises. You're worried about him, so you take him to the doctor. When you get there, the doctor examines him, and she says that she thinks he may have cancer. She doesn't know for sure, so you'll need to see a specialist. And in that moment, your greatest fear and your biggest challenge confront you. What's going to happen next? Could Sam really have cancer? Who's going to help us answer our questions? Then the doctor tells you that it will be 12 months before you can see a specialist to get answers to your questions. Fortunately, this is not the story of childhood cancer, but it is the story of autism. Autism spectrum disorders affect more children than pediatric cancer, AIDS, and diabetes combined. In 1975, 1 in 5,000 children were affected with autism, but today, 1 in 68 are affected. That means thousands of children are waiting for answers. They wait up to 12 months for answers to their questions and for a formal assessment. So now, imagine Sam, your 2-year-old, lively, energetic little boy. He's your only child, and he is perfect. His laughter is contagious. His bright blue eyes seem to capture the world's attention. But lately you've noticed he seems to be developing differently than the other kids. You've seen him spending hours lining up his toy cars. He seems completely fascinated by the buttons on your shiny black dishwasher. You're worried because he seems to be slipping away. He cries more. He sleeps less. You can't remember the last time you heard him say a word, and you were scared. You know he needs help, and you know he needs help fast. So you make an appointment with your pediatrician, Dr. Kane. She's been there since day 1. She was there at his birth. She's been there for ear infections, tummy aches, well-child checks. She knows you well. And so while you wait for her to come and see you, you fill out the laundry list of developmental questionnaires that all of us parents have had to do. And the more you fill them out, the more anxious you become, and you hesitate to even finish. Because the more you do, the more you realize that there is definitely something not right. Dr. Kane comes in, she reviews the information with you, and she says that Sam may have autism. She's not sure, you'll need to see a specialist. And in that moment, your greatest fear and your biggest challenge confront you. What's next? Who's going to help us? Could Sam really have autism? And then Dr. Kane tells you that she's going to make a referral to the local autism specialist, but that it will be 12 months before you can be seen. You're baffled by this. You plead with her to answer your questions. Why isn't he sleeping? Why isn't he eating? Why isn't he talking? He's not even responding to his name anymore. She sends you home to wait and to wonder and to worry. This is the story of autism. We must do better. And the good news is we're starting to. Ultimately, we should have no wait lists for children to be seen by a specialist to get their questions answered. But until that day comes, we need to figure out a way to help families while they wait. For you see, children with autism are at high risk for many issues that affect their development and their quality of life. Some of these issues can be incredibly intense. And there are actually things that we can do, that community providers can do for children while they're waiting. But the problem is, providers have very little expertise or understanding of developmental disabilities. We get very little training as doctors in developmental disabilities. And so what that results in is physicians feeling ill-equipped to answer families' questions. And then children like Sam and his family are left in limbo. But what if there was a better way? ECHO Autism is an innovative approach to mentorship. It's partnering with primary care providers to help them understand best practice autism care in their own communities. ECHO Autism is increasing capacity for children where they live so that they can have answers while they wait for a formal diagnosis. One of the things that we do, we have expert teams all across the United States that are growing and building. These expert teams are made up of developmental behavioral specialists, child psychologists, pediatric dietitians, social workers, and parents. For you see, parents are the experts. Parents are the lifeblood of understanding children and the issues that they're facing. And so we bring them to the table to deepen our understanding and to provide vital insider information to allow us to increase our knowledge and allow our providers to grow. One of the parents that we work with is Alicia. And Alicia is Sam's mom. Sam is no longer a 2-year-old with developmental concerns. He's now 15 and he has autism. Alicia brings an expertise to the table that can't be taught. She is living proof. She's been there. She's been through the wait lists. She's been through the questions, the fears, and now she's a lifeline to other families as they walk this same path. She reminds us that there's a grief process that happens when you're faced with a question of autism. She helps the physicians and the providers to understand that there's a family behind the medical jargon and the medical diagnoses. She brings autism to life. But one of the most important things that she does is that she shows us the joys and the celebrations of Sam. From the moment that Alicia came to the expert table, we knew this was so important. Providers she provides something that can't be taught in medical school or fellowship training. It's the kind of lived experience that's priceless. One of the most important things that she's taught us is to meet families right where they are. If they're grieving, be patient. If they're hopeful, be their cheerleader. And if they're frustrated, be their advocate. Alicia brings autism to life. Her strength, her compassion, and her resilience are a lesson to us all. ECHO Autism is bringing best practice autism care to primary care so that children like Sam and doctors like Dr. Kane can have information and knowledge and power in their own communities to make a difference for children. ECHO Autism's main goal is to provide efficient, interdisciplinary, family-centered mentorship to primary care providers so that no matter where you live and no matter the expertise of your providers, you have access to the kind of care that's necessary to keep moving forward. So when we think about how do we change the system, ECHO Autism is leveraging technology and relationships to change that system so that families, even if they do have to wait, even if we can't change that system, families have answers and they're not waiting in limbo. For families, moving forward is one of the most important things. So now I want you to think with me. Now that you know the story of autism, I challenge you as citizens of our society, of our world, to think about how you can help change that story.